Greetings, South Fulton. Thank you for joining us once again for South Fulton 101. Today's offering for South Fulton 101 is focused on the City of South Fulton's response to the COVID-19 global health emergency. As you may know, South Fulton 101 is our official webinar series that is coordinated through the City Manager's Office, including a variety of different partners and subjects to really bring the administrative operations of the city directly to our residents, businesses, and other key stakeholders. I am Odie Donald II. I have the pleasure of being the first permanent city manager for the city of South Fulton. And in this role, I have the opportunity to work with a variety of dynamic administrative leaders who are responsible for delivering world-class services to our citizens. And South Fulton 101 is actually one of those offerings that helps us provide clarity, insights, and key information to our residents. The goal of today's presentation is really focused on kind of defining what the COVID-19 pandemic is and how the city of South Fulton can let our residents, businesses, and other stakeholders know about the work we've been doing, how you can remain safe, and how to really adjust to day-to-day life during this pandemic. As many of you know, the city of South Fulton is actually one of Georgia's newest cities. We were chartered in May of 2017, May 1st of 2017 to be exact. We have begun our young government with the council manager form of government, wherein our elected officials serve as the key policy and governance actors within the city, and the city manager and all of the staff deliver these services under the advisement and guidance of our council. We are currently going through the 2020 census process where we will permanently define, at least for the next decade, our population, which currently, based on the 2010 census, is estimated at approximately 100,000 residents and growing rapidly. We also are 85 square miles and boast almost 2,000 businesses within the city limits. Our governance structure, as mentioned, is a council manager form of government, and our council is led by the first ever mayor of the city of South Fulton, Mayor William Bill Edwards, who many of not only our citizens, but really the entire state of Georgia is familiar with based on his time as the council representative for the Board of Commissioners for Fulton County, where he served for over 14 years. We also now have a new mayor pro tem, council member Carmelita Gums, who represents District 2, along with her other colleagues and compadres in delivering the governance of the city on behalf of those 100,000 residents. In looking at the coronavirus or COVID-19, many folks simply want to know what exactly is the coronavirus. And the coronavirus or COVID-19, which is the technical name, is enveloped RNA virus, which is named for a solar corona-like appearance in their variants. The cause of about 10 to 30% of all cases of the common cold actually, revert back to a coronavirus, where these viruses replicate at a lower temperature and basically serve and create issues within the upper respiratory tract. The corona helps the envelope virus survive in this GI tract, and the control of a transmission of colds, flus, and other coronaviruses is really difficult. It is one of the most contagious forms of any virus. When looking at the transmission of COVID-19, It is done so by respiratory secretions, which are kind of the main mode of transition. They spread through respiratory droplets that are in the air and they land on surfaces. These small droplets travel as a cloud through the air, and the large droplets kind of travel ballistically through the air, almost like a bullet. So the transmission from people before the onset of symptoms, without symptoms, has been deemed possible, but the contribution to these infections really appears to be fairly small and is mostly transmitted through droplets. And that is kind of the information that we are receiving from the Fulton County Department of Health, as well as the CDC, who is the main deliverer of any information and recommendations. What they have delivered to us is that there are a variety of signs and symptoms of COVID-19, but no particular signs and symptoms can really discriminate this form of virus from other respiratory infections that might include the flu, which is compared to quite often. And so right now, cities, local governments, state, federal, all of these various entities are working together to develop goals of mitigation strategies. And I think the purpose of this, number one, is to minimize morbidity and prevent the loss of life by flattening the epidemic curve to avoid an overwhelming stress on our healthcare system. I think Georgia is a great example of a healthcare system statewide that needs a lot of capacity. And I think the coronavirus is really highlighting that the impact to our economy based on a lack of available healthcare options is really putting a strain on our response to coronavirus. And so among these goals, we're hoping to slow the progression of the epidemic to allow for a vaccine or some other form of treatment to really help us mitigate its impacts. And so in looking at COVID-19, really at a glance, there are over 300,000 total cases. Deaths at the time of our preparation were around 8,000 deaths. We've actually learned that there are more than 12,000 total deaths and growing exponentially. We have over 55 different jurisdictions that are reporting cases, including all 50 states, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands, among others. In Georgia, there are now approximately 2,000 cases, over 60 deaths, and the actual case rate is 163.1 per 100,000 citizens, which is really exponential. These types of outcomes have actually had Georgia on the list of potential national hotspots, which is something cities and municipalities are responding to quickly to avoid the acceleration of COVID-19. So far, I think this has really kind of transitioned into a very broad national and state response. There have been some fairly significant national updates that I believe many of our citizens and those around the world have really looked at. And I think the president's coronavirus guidelines have changed, and he has recently declared a 30-day health emergency, which recommends all states, cities, and municipalities take shelter for 30 days to help to slow the spread. There are a variety of different activities and directions that have been provided by state and local authorities, and I think our federal partners have really urge citizens in these respective municipalities to really listen to those authorities. If you feel sick, stay at home. If your children household is tested positive for the virus, make sure you keep the entire household at home. Don't go to work, don't go to school, and contact a medical provider. I think what we have also learned is that our older residents are very much at risk for the coronavirus. And so the federal guidelines require that our seniors stay at home and away from other people as much as possible. I think locally we put some things in place to really be able to assist services being delivered to our senior population. And so it is our hope that while we endure the length of this pandemic, that if folks abide by those things, specifically our seniors and folks with underlying health conditions, that we will really be able to mitigate the impacts of corona, as well as to be able to mitigate any unnecessary loss of life. It is really a big key that all of our residents, and our regional partners and the residents from other cities, states, and regions, really focus on doing their part to slow down the spread of the coronavirus. I think, avoiding discretionary travel, not visiting people as much as you normally would, avoiding social gatherings of 10 or more, but any, if possible. And if you work in a critical infrastructure industry, making sure that you have the correct personal protective equipment are all very important. But really chief among these is ensuring that we practice good hygiene. As the world develops and we adjust to all of these new viruses and epidemics along with the current global pandemic, practicing good hygiene is really the first line of defense. Washing your hands. Some people say, sing your ABCs, count to personal hygiene activities, but abiding by those recommended by the CDC is extremely important in making sure that we do our part in slowing down the spread. Specifically related to Georgia's response, there have been a lot of activities in response to the virus. I think we've highlighted the number of cases and the number of deaths, but I think what is really a telltale sign is that above all other reasons that people have had to go to the hospital in the months of March and April, at least 1,300 cases of the coronavirus have required hospitalization. And so this has really put a spread and a stress on our hospital and medical system. And so Fulton County, which City of South Fulton is a part of, actually became the first county in the state to hit 1,000 cases. And so in doing so, it makes us one of the largest and hottest spots for the spread of coronavirus. As a result, Governor Kemp named the Coronavirus Task Force and Community Outreach Committee to ensure that our communities, those throughout the Fulton County and the state of Georgia greater area, are aware of what is happening. Actually, Bernice King, the daughter of Martin Luther King Jr. and the CEO of the King Center, which have all been great partners to the City of South Fulton, have been appointed with our recommendation to the Coronavirus Task Force. And so we are thankful to the governor for ensuring that communities such as ours are represented and that partners to our community will serve as a voice on this task force as different decisions are made related to mitigating the COVID-19 pandemic. Specifically here at South Fulton, I think it has been well documented that we have led the region in being proactive in responding to the COVID-19 pandemic. As early as March 10th, we started to notify not only our community, but also making recommendations to the governor, our federal partners, and lobbying for resources in preparation of the pandemic, taking action on March 16th, where we discontinued all in-person services and programs indefinitely in an attempt to mitigate the spread. We also launched a dedicated web page on the same day, providing updates to our residents and distributing a wealth of information in preparation of the coming changes to day-to-day life, as well as giving local, regional, and national updates. On March 18th, in his wisdom, our mayor declared a state of emergency for the city, which allowed us access to additional local resources, as well as putting the state on notice that we need the access to these additional resources. As the pandemic has continued to linger and enforcement actions have really started to ramp up, as recent as April 2nd, the city issued its own shelter-in-place order that included the closure of non-essential businesses as the city works to slow the spread and minimize the effects of COVID-19. On April 13th, as city manager, I proposed a gladiator benefits program to the council to serve as an alternative pay program for our essential employees, ensuring that they're still able to receive full pay, access, as well as an additional form of compensation for the great efforts and lengths that they have taken to not only enforce our laws, rules, and regulations, but really to ensure that services for the city continue to move forward, allowing us to move forward on this path of self-realization that our residents have been focused on for so long. The details of our shelter-in-place order are fairly specific, but provide some not only guidance, but also some relief to our citizens as they not only protect themselves, but really try to get access to goods and services that allow them to really respond and stay safe during this public health crisis. And so our curfew remains in place. It is from 9 p.m. to 7 a.m. We have prohibited all public gatherings of 10 or more persons. Initially, while we were very out in front, we had made gatherings of 250 or more the actual prohibition, but the spread of COVID-19 has really kind of set us back and made us, want to take the next steps to ensure that our public is safe. And so all of our businesses within the city, with the exception of medical and pharmaceutical establishments, must close access daily by 9 p.m. We've also canceled all regularly scheduled city council meetings and other city boards, agencies, and commissions, with the exception of emergency city council meetings that allow us to respond and keep the business of government moving forward. And so when looking at moving our services forward and kind of keeping our citizens and their daily life as intact and in place as possible, our local services do remain continuously, and we are providing as much real-time, up-to-date information as possible to our residents. Of course, we encourage you to not only monitor the website, but also register for our newsletter. It is one of the most real-time and most effective products that we are utilizing to spread the word about our reaction, key things that will keep you safe, as well as access to additional services that may not have been available before. So City Hall is currently closed. Other facilities, including our parks, recreation, and arts facilities, are closed. And we have suspended programming in those areas until further notice. We have also postponed all of our cases that were pending in our municipal court. And so we have provided relief to where our residents can still settle a fine online, but those that are not eligible or have that available, we also have suspended bench warrants for those that were in good standing at the time of our postponement. And so those folks with pending cases in our court system do not have to worry and can ease their minds. Our police and fire have really served as the primary responders and essential service providers, while our community development and regulatory affairs department has also been a primary essential staff services provider. And so we've made sure to provide all of these partners with the appropriate personal protective equipment, which is really key during these times. Our officers will also meet residents outside to take reports. All of our inspections, public and life safety educational programs have been suspended, but we have some online offerings that are available to our residents. We've also suspended all of our non-essential work-related travel to reduce the chance of our staff members receiving exposure. Our Facebook page is not only for the city, but also social media across our police, fire, code enforcement, and other areas are being updated with the same types of information to ensure that our residents understand, what we are doing. But more importantly, what we also want to focus on is what you, as our valued residents, are able to do to not only protect yourself, but also support the city. And I think the number one thing that you can do for the city, yourselves, and your family is to follow the CDC recommended precautions. Wash your hands with soap and water. If it's not available, use hand sanitizer. Wear a face mask if you are sick. Actually, I think the CDC guidelines now say wear a face mask, period. And so we encourage you to do so. We would also encourage you to clean and disinfect frequently, touch surfaces on a daily basis. I think, I personally and some of our staff have weighed in that we're doing so 3 and 4 times a day to ensure that we are killing all germs. If surfaces are dirty, it is important that you clean them. And so the CDC recommended precautions should be used as a baseline, but we encourage you to go beyond that if you have the capacity to. Always avoid touching your eyes, nose, and mouth. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Make sure you throw all used tissues in the trash and ensure that you are taking every precaution to, again, keep not only you, but your family and the city safe. Another area that we have received inquiries on is, whether you should be tested for COVID-19. I think that's a very good question. For the most part, we have the insight that we've received from the CDC that we are passing to our residents is to ensure that you follow the guidance from your healthcare provider. If you feel sick with a fever, cough, or have difficulty breathing, if you've been in close contact with the person known to have the COVID-19 virus, or if you recently traveled from an area with an ongoing spread, these are all reasons for which you could be tested, but it is best to allow your healthcare provider to make. And so if you have additional questions, concerns, or areas for which you would like to inform the city of, which may include non-adherence to our guidelines, or providing kudos and insights to staff members who responded positively on your behalf, feel free to continue to utilize the Citizen Response Center. Want to make sure that you have that number. It is 470-552-4311. And this is a 24/7, 365 days a year call center that is readily available for our residents and ensures that we are not only responsive, but also you have the information that you need at your fingertips as we update it. There are a variety of additional resources that are available. Here's a snapshot of a few of them, ranging from global case numbers to our website, as well as U.S. and Georgia case numbers. I would request that you start with the City of South Fulton's website, specifically our response to the coronavirus, because it will have key local information, but please do not be afraid to utilize the information that's provided by the CDC as a supplement in your primary response tool. Really looking at what not only the CDC is doing, we also wanted to share some of the information that has been provided by the Department of Public Health and our partners at Fulton County related to who is at highest risk, the incubation period, symptoms to be aware of, how to prevent the spread through your hygiene, as well as what to do if you think you or a family member has coronavirus or COVID-19. So I am thankful for the response of our citizens in partnership with the city. It has been unbelievable, and because of that, we have less reported cases and, in effect, less deaths within our city than projected by the Department of Public Health and the CDC. And it is our hope that we continue with, a lack of cases and no loss of life within our city. And so despite this global pandemic, we are well on our way. And I would like to thank you for tuning in to the South Fulton 101 series, using this information to the benefit of you and your families, and continuing to support South Fulton. And with that, I'd just like to thank you all.